Hi, this is Dr. Jason Tripp. I'm a chiropractor and naturopath right here in Hermitage, Pennsylvania. And today we're talking about shoulder pain. If you're having shoulder pain, could have put a comment in the section below and just say, yes, I'm having shoulder pain. If you're having questions, anything I don't answer in the video, you'd like to find out about shoulder pain, leave a question and I'll try to get back to you as soon as I can and give you some answers. Now, I'll tell you that a lot of people who have shoulder pain, our worst mistake that we make is that we'll think, oh, it's just a muscle, it'll go away. And so everybody I've seen who had frozen shoulder and now they can't move their arm past here, all started out saying, well, maybe it'll just go away, no big deal. And I'm going to tell you, if you're having shoulder pain, it's a big deal. You should be able to get that arm all the way up next to your head on both sides, full range of motion, forward and backwards. If you're not able to move your shoulders appropriately, then there could be something that's very devastating called frozen shoulder. And so we run through a shoulder severity evaluation. Basically, we're looking to see how bad that shoulder is. So we do the evaluation on the shoulder. We also check the elbow to see if there's any complicating factors shooting back up, making pain there. And then you also want to check the neck. In a lot of cases, there's a neck issue causing shoulder. Not all cases, but in a lot of cases. So you want to check neck, you want to check shoulder, you want to check the clavicle going into the chest. You want to check the rotator cuff. Like there's several things. So we go through the full gamut. We check the shoulder, make sure. Now, if it's a surgical case, I'm going to recommend seeing your surgeon. That's not something I do. As a naturopath and as a chiropractor, we look for natural means with no drugs, no surgery, and to restore the function naturally. I will tell you about 85% of the time, we're going to find that the person can be helped from a natural perspective. And that's important because a lot of people think that shoulder cannot be helped except with surgery. If you know somebody who has shoulder pain and they're thinking they just have to have surgery and there's no other option, so they gave up. And a lot of people do, they give up on it. Then show them this video, share it with them on YouTube or Facebook or Google or wherever you have to. Share this video. You can have relief from pain without having to have surgery. Now, sometimes surgery is needed, but in more cases than not, if you catch it in time, you do not need to have surgery. Minor tears, little tears in the muscle, you don't need surgery for that. Many times there'll be a surgery done, or those kind of things. If it's an avulsion, complete avulsion, that's where the muscle tears completely, then obviously that's a surgical only case. But I'd say 85% of the time, that's not the case. So when we do the exam, we're looking at all 9 factors for neuromusculoskeletal, I mean nerve and muscle, and how it relates to the shoulder. We do the exam for that. Then we use something called trigenics to restore the function back to that shoulder. It's a specialized training that a doctor out of Canada teaches on how to restore shoulder function. And we use that here in the office. So we've had a lot of people who came in and literally it was like this, and then just a few visits, they're all the way back up again. And so if you can see that kind of change in a short period of time, it's definitely worth checking out. We'll walk you through the process, but I'm going to encourage you to at least get the shoulder pain severity exam. How bad is your shoulder? If it's just a tight muscle, it'd go away in a couple days, 2 or 3 days, that problem's gone. You can massage it, you can ice it, you can stretch it, that kind of stuff. If that gets the relief, it's just a tight muscle. If you're having a problem in your shoulder longer than 7 days, longer than a week, I'm going to tell you it's probably nerve or it's probably some other pinch in there. Whatever it is, we need to find out exactly what it is so that you can then start the process of rehab to fix it. And of course, which rehab depends on how the exam goes and what your problem really is. So again, I'm going to recommend get into the office. Let's take a look, see what we can find on there. If there's help for you, I'll let you know. If there's not, I'll let you know that too. So this is Dr. Jason Tripp. Call the office 724-342-2225. If you have any questions, put them in comments below. If you're having shoulder pain, put it in the comments below and just say, yes, that's me. I'll be glad to help you any way I can, and we'll talk to you soon.